So if you wear makeup, makeup has like iron oxide, which is the component that blocks you from getting like visible light pigmentation damage. But if you're somebody that doesn't always wear makeup and you want your sunscreen just to be all encompassing and have everything that's going to protect you from hyperpigmentation, then you want to make sure it's tinted.
Interesting. Huh. I had no idea.
Remember, not the way I do. It's getting late September, and I still think about you.
Hi everyone, I'm Callie, and welcome back to another episode of Sensitive Conversations with Cetaphil, where we're diving into a topic that's both incredibly important and often misunderstood, which is caring for skin of color. So our expert today that we're calling in is an expert not only in treating diverse skin, but in hair loss, among many other things. She's a board-certified dermatologist in Tampa, Florida. Welcome to the podcast, Dr. Chauncey Barbulescu.
Thank you so much.
Yeah, we're so excited to have you here.
Excited to be here.
So typically on the pod, we like to get to know our derms a little bit. So first and foremost, what inspired you to become a dermatologist?
So it's kind of funny because honestly, when I started out in medicine, I thought dermatology was going to be the last field that I would want to go into.
Really?
And that's just because like when you think of dermatology without knowing what it entails, like I thought it was going to be a bunch of just monotonous skin checks, but it's so much more than that. So what initially drew me in is my love for hair loss. So when I started in medical school, I started doing research and presenting at conferences about hair loss and how we can treat it. And then that kind of just opened my eyes to more within dermatology and then also learning about the void that there is when it comes to skin of color.
And hair loss is hard to treat, isn't it?
It can be. There is not a lot of FDA approved treatments for hair loss. A lot of it is like a little bit of this, a little bit of that, and you kind of make it unique for each patient. One of the other things with hair loss is that there's so many different reasons for hair loss. Like a lot of patients, they'll come in and they'll say, I have a diagnosis of alopecia. And they'll assume that's their diagnosis, but alopecia just means hair loss, and there are many different types.
So what did you want to do then when you were in medical school? What did you think you wanted to do?
I initially thought that I wanted to do surgery. Like I was thinking plastic surgery.
Oh, plastics? Okay. Well, I feel like dermatology is kind of similar.
Right.
Yeah.
The reason that I realized that surgery wasn't for me is that I like to talk with people and, with plastic surgery or surgery in general, your patients, they're asleep.
Yeah. Oh,
that's
fair point. Yeah, you can't do much talking when you're under anesthesia. Well, I feel like it's so funny though because in derm, again, the two kind of go hand in hand, but you can kind of do similar things with like injectable aesthetics and that kind of stuff. Do you do a lot of injectable aesthetics or?
So that's what I like about derm. It's a broad range of things that you can, do or specialize in. So for me, I do a lot of specialization within hair loss. I see like general dermatology patients. I perform surgeries and, skin cancer excisions. I, remove cysts. I do cosmetics. We do it all.
You do it all. And I think a lot of people, that's a common misconception for people when they look at dermatologists. They think that they're just doing skin checks. Even you, right? Like you had that misconception too, even in going into medical school. So there really is a lot more to it than that.
Definitely.
So, okay, our next question is, what is the funniest or most surprising skincare myth you've heard from patients about darker skin tones?
Okay, so I'm going to bring this one to the scalp. So basically that we need to grease our scalps, as Black women, even I guess Black men growing up, most people think that they need to put grease on their scalp to hydrate it.
You mean like oil?
Yeah,
okay.
So like petroleum-based oils that have like other additives in it, but typically like we grow up greasing our scalp. And that is something that actually you do not want to do. It can do the opposite because if you think about it, our scalp is the area that produces sebum, already produces oils. So when we add more oils to our scalp, it actually could lead to conditions like seborrheic dermatitis, which is from an overgrowth of yeast, which can lead to inflammation on the scalp and hair loss. So we don't want to grease our scalps. This is something that like it's basically something that we all grow up with. Like
Right.
even me saying this and saying that, that's a myth, my mom will probably watch this and have
she's
a heart
like,
attack.
nope.
She'll be
She's
like,
like,
now,
I'm
why
sorry to
would
do
you
it
say
though.
that? You need to grease your scalp. Actually, my daughter's scalp was just greased a couple weeks ago when she was at my mom's house because she's so
And
pleased with
she
it.
came home and you're like, absolutely
I
not.
wash it.
Yeah,
but-
yeah. So the flaking then, that's from yeast, not
Right.
being dry.
Exactly. So
Okay.
it's usually from a buildup of yeast. And it's something that honestly, I see probably like 10 to 15 patients a day, even with
Yeah.
some form of seborrheic dermatitis. And a lot of the times that is one of the things that I'm educating them on.
Interesting. I love it. Fascinating. I always learn something new like every podcast episode.
Right.
And so like that's I'm like, I would have had no idea.
Right.
Like, no idea. Okay, our next question is, do you have a personal skincare mishap you're willing to share? Because nobody's perfect, even our
Right.
derms. So, confessions. We listen and we
Yes.
don't judge.
Yes. Okay. So I will say the biggest mistake that I made derm related is when I was in my intern year. Notoriously intern year, we work a lot of hours. Like we work 80, sometimes more hours a week. And so it's sometimes hard to find hairstyles, especially when you have textured hair that can allow you to work so much and not put that extra time in taking care of your hair. So I got a wig and I knew better not to like glue it in because that made sense.
Right.
If you glue it in, you're probably gonna like have hair loss, could have irritation. Like I knew that even intern year. But what I did was I put wig combs in to hold it like right here on my sides. And even after I put it in, I was like, okay, there's a little bit of sensitivity there, but I'm just gonna, leave it because I got to get through this week and I'll take it out at the end of the week. Well, when I took it out at the end of the week, my hair came out too,
No!
2 chunks of hair right at the sides. And so,
No.
yes.
So you were like, you had bald spots?
Yes, I did. And the thing was, at first I was like, I'm not going to panic. It's going to grow back. It didn't grow back. It took forever. And I'm a millennial. I like a side part. I can't do the middle part. I cannot do the middle part. So I was like, my goal was I need to get my hair back on my side so I can do a side part.
Yeah.
So you can see it's still a little thin, but at least some of the hair, like as I started learning more about dermatology, more about like proper hair
Wait,
care. And
how
things
long
like
ago
that.
was this?
This happened 2015.
Okay, so 10 years ago.
Yes.
And you said
Yes.
you're still struggling to have it.
I mean, it came back because I wouldn't do any like styles to the side at that point. I had to get creative with how I styled my hair, but no, it's still in the process of coming back. I'm actually probably going to do a PRP treatment to myself to help it even further. But yeah, no, I've even had mishaps.
Another reason why I was so inspired to talk about this on the podcast is when I was a rep working for Cetaphil, I came across Galderma's publication in the JDD, and we made a skid of color atlas. And the thing that stood out to me was 2 things. So one, how different skin conditions looked on different skin colors. And 2, they kind of gave us the background on how it was developed. And they developed the pictures based on a Pantone scale instead of a Fitzpatrick scale. So for those of you watching that don't know what a Fitzpatrick scale is, in dermatology, things are typically graded or measured on a scale through 1 through 6. So I would be Fitzpatrick 1, and then it would go 1, 2, 3, 4, 5, up to 6, 6 being the darkest, and that's how you would label someone or classify their skin. But you think 6 skin tones across the board, it's very small.
Right.
And so it was interesting, one, to see a comparison where it's a lot more similar. Like, for instance, there's Fitzpatrick 4, we'll say. Fitzpatrick 4 can look pretty different.
Right.
But when it's a Pantone scale, it's matched like almost perfectly to like the shade. It's easier to educate people to know what that looks like. And so that was the first thing. But the other thing was just how different everything looked. And derm, we've talked about this before on the podcast. It's one of the only, if not the only, specialties that you diagnose something just by looking at it.
Right.
And so that's hard if you are going to medical school and you don't have the proper training to know what that looks like on darker skin tones. Because, just because it's a minority doesn't mean it's not important, or like you're not going to see it every day. You mentioned like you see a lot of patients that have darker skin.
Hmm.
So unless you have the proper training,
Right.
it's really hard to diagnose. And I'm sure there's misdiagnoses all the time because of that, for like the hair loss, but things like that
Even
people,
with skin, like you're
yeah.
saying, if you think about like you open our dermatology textbooks and let's say something as simple as like eczema or atopic dermatitis, which is so common. If you look in there and you see the description, you'll usually see it saying like erythematous scaly patch or like a red rough patch.
Hmm.
If you think about how that looks on someone that has darker skin, you may not be seeing red on their
Hmm.
skin.
Yeah.
It might present as like a deeper hue or like violaceous or even like pigmented, or brown.
Hmm.
So if somebody comes in, a practitioner, and doesn't know how that looks because of training from
Hmm.
our textbooks that have been around forever, um, they might even diagnose something as simple as eczema wrong, or maybe
Hmm.
it looks like just post-inflammatory hyperpigmentation, or dark spots,
Right.
basically, instead of seeing that it's an active inflammatory situation going on, because
Hmm.
again, it may not present as erythematous
Hmm.
or red. And again, back to what you were saying about the Fitzpatrick scale. So the Fitzpatrick scale itself has a lot of flaws within it, especially when it comes to describing skin of color.
Hmm.
And that's just basically as like what you were saying, that, pretty much skin of color gets Fitzpatrick label of 5 or 6. And there's so many different like color combination
Hmm.
mixes
Hmm.
that doesn't really encompass what is out there. And the Fitzpatrick scale was initially developed to assess how somebody's skin is going to respond to UV. And so a
Oh, that's,
Fitzpatrick
yeah.
of somebody that has like a type 1, like your skin, that would mean that they always burn and they never tan. A Fitzpatrick of a 6 would mean that you always tan and you never burn. So if you're thinking about how that, sun exposure comes into play, and if you're saying that you never burn and you have a Fitzpatrick type 6, that would make you think that they're less likely or they can't even get skin
Yeah.
cancer. So that also leads into this bias where, if a dermatologist thinks that their patient can't get skin cancer, they might not even educate them on, if they have darker skin, about the risk of UV, when in fact they can get skin cancer.
That is another great segue into what we're going to talk about next, which is common myths. So, a common myth is what you just said, which is darker skin doesn't need sunscreen. So, can you talk about that a little bit?
Yeah, so everybody needs sunscreen. I'm gonna say that right now. So when you think about if darker skin needs sunscreen, most people feel like they don't, just because they feel that, if you have melanin, you're gonna have some protection from the sun and it's gonna be less likely for you to get a skin cancer.
Mm.
And so that is true. Studies show that the average amount of sun protection that somebody who has darker skin may get from just having the pigment in their skin is about equal to a SPF of 13.
Hmm.
But if you think about it, even I would never recommend that a patient wear an SPF of 13 and call that completely protected,
Hmm.
or in a range where it's protected enough to protect them from skin cancer. Most dermatologists are going to recommend that you do an SPF of 30 or higher. So that clearly is showing that even having a baseline SPF protection of 13 isn't enough, and you still can get
Right.
skin cancer.
Yeah.
But beyond even just if you don't want to, wear sunscreen to protect yourself from skin cancer, also wearing sunscreen protects you cosmetically. It keeps you looking like you longer.
Right.
So we know UV basically can, damage the skin, can degrade elastin, can degrade collagen, which leads to wrinkles, can also cause hyperpigmentation. And honestly, hyperpigmentation is one of the main things that I see patients for of color. So sunscreen is like a crucial step at even just keeping you looking like you longer.
Hmm. I know that sometimes people with darker skin struggle with sunscreen because of the white
Right.
cast. So what do you recommend for them? Things to look for, or maybe ingredients to look for or not, or to stay away from, etc.?
So companies honestly have been getting a lot better with making physical block sunscreens, and those are traditionally the ones that can make us look kind of casty when we apply
Mm-hmm.
it to our skin. But they've been doing a decent job at making them a little more sheer, where they're wearable now. I do like. I like either. Whatever a patient is going to wear, I'm happy with,
Right.
whether it's physical or chemical. I usually lean a little bit more towards the physical side of things, and that's just because chemical sunscreens can cause more irritation as they're being absorbed into the skin, whereas a
Mm-hmm.
physical sunscreen is just going to be like a physical block
Right.
and blocking, your skin just sitting on top, blocking it from UV damage. So, again, whatever you're going to wear, I'm happy with. I usually recommend a tinted sunscreen. And that's just because the tint is going to also block you from visible light, like the light that we're getting exposed to, from the lights in this room, our phone, computer screens. All of that can lead to increased risk of hyperpigmentation too,
Even
right?
normal lights?
Even normal lights. So,
I am learning so honestly, I think this is the most I've ever. We're not even halfway through and I'm learning so much. I did not know that.
yes. So if you wear makeup, makeup has like iron oxide, which is the component that blocks you
Mm-hmm.
from getting like visible light pigmentation damage. But if you're somebody that doesn't always wear makeup and you want your sunscreen just to be all encompassing and have everything that's going to protect you from hyperpigmentation, then you want to make sure it's tinted.
Interesting. Huh. I had no idea. Now I'm gonna be better about wearing my sunscreen now, because in my mind I'm like, I'm indoors.
Right. Nope.
It's fake light.
I'm going to be keeping my eye on you,
Yeah.
Callie.
I I will allow you to hold me accountable. So let's dive into our next myth, which is skin of color, doesn't get sunburned, and doesn't scar. What do you have to say about that?
So sunburn, we know skin of color does experience. Even if you have a Fitzpatrick type 6 or darker skin, you still can experience sunburning. It may not be, what you expect. You may not see peeling. You might see peeling. It may present as like just irritation in the skin, pain on the skin, itching on the skin. It can present in different ways, but you definitely can have some sun
Okay.
burning experience. And scarring is actually something that we see a lot in skin of color. There's something called keloids, which is like an overgrowth of scar tissue that grows outbound from the incision itself or the injury itself. And that's really problematic in darker skin types. So this type of scarring, if you even think about like the treatment for that type of scarring, can be really hard because a scar or a keloid is going to come from trauma to the skin. And a lot of ways that we treat it is causing more trauma or doing a, procedure to excise the keloid, So technically doing that can make things worse. There is another way that we can treat keloids, which basically are injecting them with a little bit of intralesional steroids. But again, that's risky as well when treating darker skin, just because the side effect of treating them with injection steroids is causing a light spot on the skin. And obviously causing a light spot on the skin is going to
Oh,
be more visible if your skin
right.
tone is darker.
Fascinating. I didn't even think about that. And is there a reason why keloiding is more common in skin of color?
So it's just the scar process itself. So the genetics behind people who have, are of African descent just have a more robust collagen production,
I see. Okay.
And it may even be saying something to the fact that typically like just skin in general of people that have darker skin have more collagen in them just
Yeah.
at baseline. And that's usually one of the reasons that you see, people with darker skin don't age the same, So I
Mhm.
think, again, it has to do with that robust collagen production.
Yeah. And your comment about the steroid injection and how, it can cause like lightness in the skin, which will obviously be a lot more visible. And then also your comment about how, adding more trauma to the skin can make things worse. Can we talk about lasers a little bit? Because
Sure.
lasers, I'm not educated at all, and I have friends that ask me like, "What's the best laser for me?" And I honestly have no idea, and it's something I never even thought about. That I'm like, in my mind, I'm like, skin to skin, like whatever, it's a
Right.
laser, like it should be fine for everyone, but it's
Yeah.
not. So maybe educate us a little bit about that.
So lasers you definitely want to be cautious with when you have, more melanin in your skin. And it's not to say that you can't have laser treatment at all. There are lasers that are safer for darker skin types. Typically the laser that you want is a laser that's not going to produce too much heat or trauma to the skin, because if you have darker skin, your melanocytes are usually a little bit more reactive. So we worry about, hyperpigmenting or even hypopigmenting, causing light spots on the skin if there's too much heat delivery.
Okay.
We worry about like scarring the skin again, with having keloids be at a higher, rate in people that have darker skin. So you definitely want to find a practitioner if you're thinking about getting laser treatment, which laser treatment is great, but you want to find somebody who knows how to properly treat dark skin to avoid those adverse risks.
That's really interesting. I think it's so important that people are educated on that because again, that's something I didn't even think about, it's just so important because no one wants to, you know, go and then have some sort of adverse
Right.
reaction and then you leave feeling worse than you did when you came in. So,
Exactly. We
yeah.
want laser treatment to improve our aesthetic, not worsen it.
Exactly. Okay, so our last myth that we'll cover is all products work the same for everyone. So, what do you have to say about that?
So I do think that that is not true. So I
Mhm.
agree with it being a myth.
Mhm.
Basically, I feel like it's very individualized as to what products are going to work for you, and it definitely depends on what you're going for. So, for instance, if somebody comes in with acne, we'll most likely probably treat them with a retinoid, which is like the jack of all trades, can do
Mhm.
a lot of different things, can help with acne, help with pigmentation, help with aging, but there's a range even within retinoids. If somebody has really dry, irritated skin, I might start them on something over the counter like adapalene. If somebody has skin that's like more oily, doesn't typically get irritated, I might start them with a stronger retinoid like tazarotene. So even prescribing retinoids can range.
Mhm.
There's other products like exfoliants. Again, glycolic acid is a common one that you see a lot. If somebody has more sensitive skin, I might recommend mandelic acid, which is a little bit gentler to the skin. So it really all depends on that specific person.
I see. And so for hyperpigmentation, I know that's a common concern. I mean, really for a lot of people, but
Mm.
how does the treatment for that vary depending on the person?
So there's a lot of products that I like for pigmentation.
Mhm.
Again, it's going to be a retinoid. I like, exfoliating agents. I like tranexamic acid, which can be topical or oral. I like kojic acid. The gold standard topical cream for getting rid of hyperpigmentation is hydroquinone, and that is a really powerful tool. And I do use that sometimes. I think, again, it goes back to that individual person. So
Mhm.
if they were someone coming in and let's say they had really dark skin, I may shy a little bit away from hydroquinone because, like I said, that one's really powerful and it could cause too much lightening and then
Mhm.
make the opposite issue happen. Also, hydroquinone can be more irritating than like
Mhm.
kojic acid or tranexamic acid. So if somebody comes in and they say that they, have a lot of irritations typically when they try products, I might leave out hydroquinone altogether and do one of the more gentle lightening agents.
Mhm.
Um, so I would say, again, like they're all great, but it's very personalized.
Okay. And are there any unique skin concerns for skin of color or skin concerns that present themselves more in those patients?
So I will say, since I see a majority of skin and color patients, it is the pigmentation. That is like number
Okay.
one. It's hair loss. I see a ton of hair loss. Seborrheic dermatitis. Again, the flakiness of the scalp. I see a lot of that. Um, Also, I guess if we want to even talk a little cosmetically, I see like basically what happens to everybody, but like sagging of the skin. I see
Okay.
less wrinkling. I do less Botox, I will say, for skin of color, but everybody, gravity gets everybody. So
Yeah.
I will see like more patients for filler for skin of color.
Okay. And what are the most common misdiagnosed skin conditions in skin of color patients?
I will say that's hard. I'm going to say skin cancer. because
Oh, okay.
nobody is looking for skin cancer, again, with the whole Fitzpatrick
Right.
scale and thinking that, people with darker skin can't get skin cancer, providers, and even like people themselves thinking that skin cancer is something that doesn't happen. Like
Hmm.
that misinformation often leads to people getting diagnosed with skin cancer at a later stage and even having high mortality because they're not expecting to have a skin cancer.
Right.
Even like when people with darker skin tone go into a dermatology clinic and, they're not most of the time not really asked about like sun protective measures or asked about skin cancer risk
Hmm.
like somebody would if they had lighter skin.
Right.
And even I had a patient, this was a couple months ago now, that I was seeing specifically for hair loss. But before she left, she was like, do you mind just looking at a spot on my leg? She's like, I've been to my dermatologist about it. They reassured me that everything was fine, but I just want someone to look at it one more time. So again, I was already in there for like 30 minutes because hair
Hmm.
loss takes a long
Right,
time. But
right,
I was like,
right.
let me just peek at it. And I peeked at it and I was like, that's a skin cancer. Like that, like
Wow.
literally she went
That's
even to the
crazy.
derm. I'm like,
So
let's
how long did she have that skin cancer
for
for?
a while. And
That's
she was
terrible.
told, I guess, that it was just abrasion or injury from her shoe strap being there. But no, it was a skin cancer and she had to have Mohs surgery and everything. Now she's getting her
Wow.
skin checks.
See,
But
that's exactly why that education piece is so important because
right,
obviously people looked at it, it probably looked different than what they were
right.
used to seeing when they're trying to identify skin cancer. And this woman, obviously cancer spreads. So the longer it's there, the worse,
Outcomes.
exactly. So for, I guess, what is it, does it look different? And for, uh,
I honestly think so. Typically, what we tell patients and what we look for is if you have a sore and it's not healing, you're not
mhm,
touching it and it's not getting better, like that's not normal. Skin shouldn't behave that way. So it's not even like it looks so much different. I think it's just that misconception out there that, people with darker skin can't get
right.
skin cancer. And honestly, she wasn't even like of the darkest skin tone. She was like maybe she's I think a little lighter than even my complexion.
Mm,
And it's just again just misinformation,
mhm.
ignorance that might cause people having worse outcomes.
Right. So for those, I know you mentioned you tell your patients if there's a lesion or something that's not healing, it's not a good sign.
Right.
Is there anything else for people to watch out for? Obviously, go to see your dermatologist every year to do a thorough skin check, but anything people can look for at home that maybe, they see a spot or
Hmm.
something pops up that they should maybe get a get another opinion on.
Yeah, so for skin cancer, even in dark skin patients, the more common types are going to be your basal cell or your squamous cell, which squamous cell being more common. Those are going to be the ones that are going to present as sores that just don't heal. Squamous cells can be more prone to present themselves in areas of like injury or trauma. So if you had an area that was like frequently injured or scarred and now there's like a spot growing in there,
Mhm.
that could be a squamous cell and is worth getting checked out. The more deadly types of skin cancer include like a melanoma. That's the type of skin cancer that can move quick and kill you basically.
Mhm.
So you definitely want to be aware of that. And actually, if you have darker skin, the area that you would think of having a melanoma is not like a high sun exposed area, actually.
Oh,
The more common types of or areas where we get skin cancer are going to be our palms and our soles. So our hands and our feet are the common areas to get melanoma.
interesting.
Yeah,
Interesting.
even Bob Marley, that's what he died from, a skin cancer on the bottom of his foot. So,
Are you serious?
yeah, so you
I
want to
had no
definitely check
idea.
those hands and feet.
Okay, okay. So not just want to clarify, it could be other places, but it's most common
Right.
in the hands and feet. Interesting.
Hmm.
Wow. This is so fascinating. I truly am learning so much and I've been in this industry for so long and I feel like I always make jokes. I'm like, yeah, I'm like an honorary derm, like I've like worked in
Yes,
the space
we
for so long
accept you.
and I like feel like I know so much, but hearing all of this, I'm truly blown away. This has been so incredible. I cannot thank you enough for
Yes,
just
thank you for
educating
having me.
myself, educating our audience. Like I know so many people are gonna find value in this. So this has just been absolutely amazing. Before we wrap up today's episode, we're gonna fire off with some rapid fire questions to kind of end on a lighter note, get to know you a little bit more too.
Okay.
So, first and foremost, what's a skincare trend that's overrated?
You know what? I'm going to do it. I'm going to say glass skin. I
Okay.
do not like
Tell me
that.
more.
So the reason why I'm over this trend is because I'll have young, like, women, teenagers come in and their skin will look amazing, but they are searching for like what's not even realistic. Like they're
Mm.
literally trying to like have not a flaw on their skin, and it makes them like not even happy with themselves, even though like I'm
Yes.
like, girl, I'm a dermatologist and I am telling you your skin looks amazing, but it's
Right.
like
You're like, I'm literally an expert in skin, and I'm
I'm
telling you
literally the
that
skin
it's,
person, not the TikTok
yeah,
people,
yeah, yeah,
and
yeah.
your skin looks great, but like they are just searching for this unattainable goal.
Right.
So like I'm
Hmm.
ready for that to
And
be over with.
that's, social media. Obviously, everyone watching this is watching it on a social
Right.
media platform. So it is great in so many ways because for things like this, it's getting the right information out there. And
Right.
so it could be so impactful to so many people to have this accessible, free education. But on the other end, there's other people that are posting things that, people think that's normal, or to your point, like you're like, this isn't attainable.
Right.
And so there's these unrealistic standards and expectations of how skin should look like, and what everyone strives to have that really isn't healthy or the norm.
Mm-hmm.
So I'm glad that you said that, because I know most people watching are probably, I mean, I'm trying to have glass skin too,
Right,
right? Like,
right.
we're all trying to have glass skin, but you're right, like it's just,
Your
it's
skin
not.
looks amazing.
Thank you. Right, exactly. Yes, I know. The grass is always greener. It's
Right.
so hard in this day and age, I feel like, for people to just accept, how they
Right.
look with everyone out there, and like filters and photo editing, etc.
Exactly.
So, next question, what is the most rewarding part of being a dermatologist?
So I live for the before and afters. I
Okay.
take photos of just about everything: pigmentation, hair loss,
Yes.
acne, and I love to see like the change after you're done with the treatment.
I can imagine that is so rewarding, so that you could truly see, in real time, physical evidence almost
The
of
evidence.
of how the patient came in versus how they're leaving once they're seeing you and you've treated them. So I love that. That's a great answer.
Yes.
What's your proudest accomplishment so far?
So personally, it's definitely going to be the birth of my babies,
Oh,
Lux and
yes.
Lennox. They're
They're
the
so
best.
cute.
Lux is probably a little dermatologist in the making, so
Yep.
I
Yep.
love that. And then professionally, it's probably becoming a dermatologist,
Yeah.
because many people aren't aware, but dermatology is like one of the hardest fields
It
to get
is.
into. You think it's hard to get into medical school, but no, it is
Mhm.
hard to get into the field of
Yes.
dermatology. But it's so needed to have different people from different walks of
Mhm.
life, different, diverse backgrounds, even like with what we're talking about today. And so I'm just so happy that I was able to even become a dermatologist.
And what advice would you give people that are looking to pursue a career in dermatology? Because one thing I was not so familiar with prior to working in the healthcare space was the match process.
Yes.
So it reminds me a little bit of, this is gonna sound stupid, but sorority recruitment.
Yeah.
Like, I was in a sorority, I'm like, this is like literally what it was like
It
being in a
is.
sorority, because
Yeah.
you have your preferred specialty,
Right.
but then that specialty has to prefer you too, and you have to, and it kind of goes down based off of, an order of interest, what you
Mm-hmm.
want to do versus the organizations that you're interviewing
Exactly.
with. So what advice would you give?
So I would say, if you have your heart on something, if you feel like that's what you want to do, you keep going. Like, don't
Mm-hmm.
let anybody deter you. Like, whatever you want to do, you can make that happen. Like, throughout my, span in the medical field, I feel like I came across people that would deter me and tell me, that I couldn't go to medical school. And then once again, when I wanted to become a dermatologist, I had a lot of people that were like, well, pick your backup specialty. And I was like, oh, no, no, no.
Mm-hmm.
Because I've always had a lot of confidence in myself. And I know that, I will get there if I'm meant to be there. I just got to stay focused. So I think sometimes people might, let those people get in their heads and, make them think that they can't do what they can do. So I would say the biggest advice is just staying determined. And if you want to become a dermatologist, you can definitely become a dermatologist.
Oh my gosh, I love that. I feel so inspired right now. I'm like, yes, I can do anything I put my mind to.
Right.
I love it. Okay, next question. What is your greatest wellness hack?
So my greatest and newest wellness hack for myself would be the use of heatless curlers.
Okay, I have tried the heatless curlers so many times. I probably have at least 3 iterations of the tool itself. Like I have the kind of fat, chunky, squishy one that's silk. I have one that it's like almost looks like octopus tentacles that you like wrap each piece. And then I have one that's cloth. And I've even tried one with socks. I've tried it all. Yeah. But is that what you did today for your hair?
Yes, I did.
It looks phenomenal. How do you, what is the hack?
I have 2 young kids, so I definitely need to do something like low time consuming and, even getting out in the morning. I don't have time to sit there and curl my hair. Not to mention, like, we all want healthy hair. So obviously if we're curling our hair every day, that's not going to be beneficial. So I use the one that you like put on top of your head and then you like roll all the way back.
So how do you take it? You take each piece or you take like a chunk or?
You take each piece and then you wrap it around almost like you're doing like a twist, but have it go around the, mine is like a soft squishy like sock almost.
Yeah.
And then you tie it at the end with a scrunchie and that's it. Couple minutes at night, couple minutes in the morning, and then your curls are snatched.
Do you dampen your hair at all, or you just do it dry?
I don't do anything. I just do it dry.
Interesting. Okay, I'm gonna try it tonight, and I'm gonna send you.
I will send you the tips.
I will send you the aftermath. I don't know. Do you think it plays a difference the texture of your hair?
Probably. Okay. I feel like it looks like your hair holds a curl. Like if your hair doesn't hold a curl,
I probably have a whole can of hairspray in my hair right now, and I used heat on it, so I don't know. But our mutual friend Haley, she uses them and they're like it's like your hair. It's like bombshell curls. Yeah. It drives me nuts because every time I've tried it.
There, Callie.
Yes, I think practice makes perfect. So I think I just need to keep trying. But I'm gonna keep you updated on my hair journey. Okay, last question. To wrap it up, what is the best advice you would give someone with darker skin tones?
The best advice is going to be taking it back to the beginning with the sunscreen. Okay. Like, wear sunscreen. You will thank me when you're 60 and you were looking 30, And like I said, even if we don't even want to mention the risk that it's also going to decrease, your risk for skin cancer, it is going to help you age beautifully. So sunscreen for everybody.
Our last episode we did, or one of the last episodes we did, we talked about sunscreen and preventative aging, and I brought up the picture of the trucker, like the truck driver. Mm-hmm. Have you seen that?
I don't think so.
Oh my gosh, I'll show you after this. Okay. It's crazy, like the before and afters, from one side is insane, and that's the one that got me. I know I should be concerned about skin cancer, which I very much am, but the aging aspect is the one that I'm like, I'm out here doing a lot of things to age backwards and look good for as long as I can. So I'm like dousing myself in sunscreen.
And that's what we want.
Yeah. Dr. Barbulescu, this has been absolutely amazing. I have truly, truly, truly learned so much. And I'm sure everyone watching is learning, just as much as I am, if not more. For anyone watching that wants to follow you, where can they find you on social media?
So you can find me on TikTok or Instagram at Dr. Chauncey Barbulescu.
Amazing. Well, thank you so much. This has been so fun. Yes. Everyone, be sure to follow Dr. Barbulescu for more skincare advice, skincare tips. Be sure to subscribe and comment below what you would like us to cover next with our experts on our next episode. Bye.
Bye.
Remember, not the way I do. It's getting late September.